Let's normalize hospice. Well, today I'm going to be talking about the end stages of a life timeline. And today I'm going to be talking about 7 days before death in hospice and what you can expect. This will help clinicians, hospice nurses, prepare their families and teach them on what to expect, and just prepare them as much as feasible to be prepared for the process of death and dying. Also, it helps for us clinicians to update the patient's plan of care. If we need to take care of a crisis period, it helps us kind of figure out if we are at that stage where we need to provide a higher level of care for that period of crisis in uncontrolled symptoms. So generally speaking, naturally, as people are dying naturally, people go through almost similar stages. Everybody's death is different. Everybody's death process is different, but there's some things that you can expect during a natural process of death and dying. Now, everybody's death naturally will look different again, but in 7 days before death, 7 days before death, you can expect at least a few things. You can expect the extremities, which is the hands, the feet, the body extremities will feel cold to touch. Now, the best way to handle this is just really education to the family and provide extra blankets for warmth. 7 days before death, some people may stop talking or reduce the amount of talking that they were doing prior to this process. There's nothing much you can do for it because you cannot make the person talk per se, but you just educate the family on this process that's to be expected. They may not talk as much as they were talking before. Some people also in these 7 days before death usually will have a problem swallowing. For all these signs, first things first is educate the family, educate. But if the patient is having difficulty swallowing solid food, you can change the consistency of the food. Maybe you can make like a pureed food, mechanical soft, where you can just grind the food, make it really soft. Just meet the patient where they are and make it easy for them to swallow. Most people are distressed because their loved ones cannot swallow well. So educate them and give them support and change the consistency of food to where it's good enough to swallow so they don't choke on the food. Now, some people in these 7 days before death can experience delirium or increased confusion. Some people have poor attention compared to what they were having before the 7 days before death. Some people have hallucinations and abnormal drowsiness and abnormal restlessness, and they might be really agitated. Also, with some of the symptoms in the last 7 days of life, some people do experience peripheral edema where the arms or the feet or the legs may swell. This is due to accumulation of fluid which results in the swelling, and most of the times it's dependent, meaning it goes to the most dependent parts of the body, such as the arms and the legs. The best way to manage this is to reposition, which is elevate the arms and legs. And sometimes if it's too bad and the person is able to swallow, sometimes our doctors will order some diuretics. Those are at least 5 symptoms that you can expect in the last 7 days before death on hospice. Next, we'll be talking about clinical signs and symptoms of death 4 to 6 days before death. See you in the next one.